Hello and welcome to Burnout and PTSD Survivors Forum. I'm your host, Brandon Earl. Today I want to talk about one of the leading treatments for PTSD. It's EMDR, eye movement desensitization and reprocessing therapy. This is used very widely. It's effective to the point that the Departments for Veterans Affairs and the Departments for Defense consider it a treatment of choice and also best practice. I had the honor of speaking to a leading EMDR practitioner from Philadelphia, Dr. Marilyn Luber, who's been doing this practice for decades. And she gave the example of a veteran, a Vietnam vet, that she'd used this practice on, used this therapy on, and the kind of problems that he was experiencing at this time and the kinds of results that he saw after having EMDR. Here's a look at that.
The work that we did. He came in for originally trauma from the war. When he came back home from Vietnam, his mother was sent a carton of dog food because that's what you feed baby butchers. That was the welcome that Vietnam vets were getting back at that time. And so there were memories like that. And we targeted some of the worst ones. One was when he was with his commanding officer and there was a child and he was running to get the child and his commanding officer stopped him. You know, he felt so terrible because the child exploded, because very often the kids were used to kill American soldiers. And so we've processed through a number of these things. And what it went back to, because EMDR is always about going back to the original root of where the problem started. And, you know, a lot of people did come back from places like Vietnam or World War II, and they did okay. And that may have been because they didn't have trauma that they were building up. So this person had an alcoholic father who sexually abused him. And so that material came up as we did the EMDR work. And so you get a chance to help clear out all of the old material, focus on the present triggers, and then generalize things by going into the future. It's a very powerful treatment.
And so that particular individual that Dr. Luber is speaking about there, he obviously had strong results from the treatment, and he himself went on to become a psychotherapist and helping people who had been in a similar situation to himself. To break down what this means in terms of EMDR a little bit, eye movement desensitization and reprocessing therapy. To start with, it's not just through eye movement, this back and forth motion perhaps by the therapist to create bilateral stimulation. It can also be through shoulder tapping, tapping the left and right shoulder to also have that bilateral stimulation. If viewers want to check out this, they can do a search for Prince Harry EMDR, and you'll see a video there of Prince Harry actually going through EMDR treatment and talking about the effects of that. In terms of the desensitization, EMDR desensitization aspect of this, you're desensitizing the kind of severe emotional response, the cognitions that are associated with that traumatic memory. And the reprocessing component, you're bringing that memory to a more neutral kind of state. Here we have a Dr. Luber talking about the step-by-step process that she will go through with a patient in doing EMDR a little bit, and that's what we'll play here. This external stimuli and the traumatic memory is brought into consciousness.
Okay, it's activated.
Activated.
And it's activated in a certain way. We don't just say, bring up the memory. We say, what's the worst part of the memory? Take a photo. What's the negative belief you have about yourself? And usually that has something to do with responsibility, safety, choice, or connection, or belonging. For him, something like I'm going to die, or I'm dying, or I'm dead, I think, something like that. And the positive is I'm alive. Okay? And so then the other thing that we do is we always are evaluating our work. So we have a validity of cognition, which tests where we are on the scale. How true is I'm alive feeling to you on a scale of 1 to 7, where 7 is true and 1 is I'm dying or I'm dead. And so we're always checking our work. So it's one of the ways to get evidence-based work in terms of whether there's efficacy or not. So after we get that, right, then we ask for the emotion. We ask for a positive cognition, because one of the things that Francine also put into this mix is she wanted to stimulate the positive neural networks. And even though the person might not be there at that particular time, you're pointing the direction of where to go. And so he said, I'm alive, right? So even though that had not been in his consciousness, perhaps, now it is. We then ask on a 0 to 10 scale how disturbing the whole gestalt is, right? How disturbing the whole memory is. 10 is the most disturbing, 0 is no disturbance or calm in your body. And he said it was a 9. Okay, and then now we're getting ready. The person is getting more into the emotion. We anchor it in the body. Where is it in the body? He felt it in his gut. And we say, okay, bring all of that together. Bring up the image, the negative words that you're saying to yourself, what you're feeling and where you're feeling. And then we do the bilateral stimulation. And so that's where we get the results.
So those are just the first steps to the EMDR process. There's obviously more to that viewers can find out about, and I'll give some information, a resource that you can look into to find out more about EMDR. I'd just like to say that it strikes me, the reason I wanted to talk about it, I think it's a really phenomenal therapy. For one, because it's drug-free, and we know that people, particularly people suffering with PTSD, they can have some very strong effects from using different medications. Side effects can sometimes be worse than the symptoms they're already experiencing. So something that is drug-free, and in the case of this example that Dr. Luber talks about, this gentleman received significant benefit after just 10 sessions of EMDR. Something else about it, I think it really honors the fact that post-traumatic stress disorder, trauma, it's not just a chemical problem in the brain. This is something that is affecting the body, the mind on multiple dimensional levels. And the fact that it's looking at memory, it's looking at cognition, it's bringing in physical sensation through this bilateral stimulation. It's really honoring the fact that trauma is a whole of body experience and attempting to resolve it on that multidimensional level. To learn more about EMDR, you can check out the emdr.com website. This is a resource that it's also a resource for people therapists who want to learn to do this practice. It's got basic therapy, basic training, advanced training, really a support center defining what the EMDR is for people who want to understand it better. And I really encourage people to go and check that out. That's emdr.com. It's not just veterans, of course, coming out of the pandemic, the anxiety associated with that. I think there's probably more reasons for people to be dealing with trauma now than they were perhaps 5 years ago broadly in society, particularly for veterans, though. Based on 2022 figures, we had twice the number of suicides among veterans compared to the regular community. So, and we know that psychological trauma is a factor in that. So it's been great to be with you today and to talk a little bit about this phenomenal treatment that I think it should be more publicly known that there's many people who may be benefiting from this who just don't know about it. So help me to get the word out about it, and please share this video and like it. It's been a pleasure to be with you. Thank you. I'm Brandon Earl, and you've been watching Burnout and PTSD Survivors Forum.
He was getting a political prisoner out of some country, and he was with his unit. Some loud noise went off, and he was blown through the ground, and so he had a memory of being blown through the ground with only his foot out, which is actually what happened to him. And after the first time we did EMDR on that, he stopped having a nightmare he had been having for 30 years.
Eye movement desensitization and reprocessing, or EMDR, is a psychotherapy used for treating trauma and other adverse life events.
The memory was getting reprocessed and changed and really transformed. You get a chance to help clear out all of the old material, focus on the present triggers, and then generalize things by going into the future.